Hello, my name is Jonathan Webster. I'm the Clinical Admissions Manager here at Gateway Rehabilitation Hospital. I'm here with Sandra Worley, our Infection Preventionist Nurse, and we're here to talk a little bit about what she does and infection control. So Sandra, tell me a little bit about PPE. What is PPE?
So PPE is personal protective equipment that staff and also patients' families are able to use to help prevent the farther spread of organisms when they visit a patient that has contagious organisms.
All right, so you've got a gown here you put on, and a mask and gloves. This is all provided outside the room?
This station is set up outside of the room, so when a patient arrives to our facility, we already have the station set up. That way there's no possible way that these organisms can get transferred from the patient to our staff or to other visitors. We have the station set up outside of the room, and it also includes the patient gown, potentially mask if that is needed, and gloves.
Okay.
When the staff go into the room, they make sure that they're already gowned and gloved as appropriate for the organism. And we use 5 different types of signs that we hang up outside of the patient's room to help identify what organism the patient is in isolation for. So when you see a green sign, that means that there can be any type of organism that's infecting the respiratory system. When you see a pink sign, it can be any type of organism that's affecting the skin or wound or blood. When you see a yellow stop sign, that's any organism that can be affecting the urine. Brown will always be the same organism, and that's for C. diff infections. And blue is very simple. Blue is for flu. Anybody that has flu precautions. And the blue and the green stop signs are actually considered droplet precautions, so masks are required for staff when they enter the room, and patients have to wear a mask when they exit the room.
Fascinating. So you actually prevent the transmission of these organisms by using this PPE and knowing what to wear by looking at the sign.
Correct. All staff are educated upon hire of how to appropriately don and doff PPE when they're entering and exiting a room.
Very good. Tell me about the stewardship here with infection control, antibiotics.
So we have an antibiotic stewardship program that includes the director of pharmacy and the medical director, Dr. Mook. And we meet once weekly, and we review anybody who is on antibiotics to make sure that they're on the appropriate antibiotics and make sure that they're on it for the appropriate amount of time, just to make sure that they are getting appropriate treatment.
Okay. And I've heard you report in the morning ops meeting on Claudia and CLABSI. What does that mean?
So CODIs are catheter-associated urinary tract infections, and those can be very serious infections for patients who have acute or chronic Foley catheters. So we make sure that appropriate Foley catheter care is being done to patients that come in with Foleys, and we try to make sure that we pull those lines, if possible, as soon as possible when the patient arrives to the facility. So I collaborate with both the physicians on a daily basis to make sure the patient necessarily needs that line. For CLABSIs, that's a central line associated bloodstream infection.
Wow.
Central lines are typically long IVs that can go up into the arm or into the chest wall that usually touches the tip of the heart. There's a chance for sepsis, which is an infection of the blood, so we want to make sure that all staff are utilizing the lines appropriately and maintaining those lines and treating those lines as needed.
So all these tubes in people's bodies looks like they're just breeding grounds for an infection, so which is even more important, the nurses and doctors and healthcare workers coming into contact with these patients wash their hands. So tell me a little bit about hand washing initiatives.
So hand washing, we make sure that we have secret hand washing surveyors.
Nice.
They go through the facility and they make sure that people are washing their hands as they're entering and exiting the rooms.
Okay.
And these people report to me on a weekly basis, and they let me know if people are being compliant. The people who are not being compliant are addressed in real time to make sure that they are educated on making sure that they are appropriately washing their hands. And we also have a very high hand hygiene compliance rate. We're typically above the nation at 96%.
That's great. That speaks volume to Gateway's care.
Absolutely.
So tell me a little bit about meeting and greeting with new patients and your role in welcoming them to Gateway and explaining them infection control.
So as the infection preventionist, one of the things that I like to do is upon a patient's new admission to the facility, if they come in contact isolation or droplet isolation, if if they have a Foley catheter or if they have a central line. I like to go and meet with them so I can provide education to them regarding the central line, regarding the Foley catheter, regarding what type of organism they may have an infection of. The first time I did this, the lady that I spoke with and provided information regarding VRE, she said, "You're the first person that has provided any type of education to me, and I appreciate
Wow.
that." So
Great.
that really helped, affirm the
Yeah.
need for that education to the, not only the staff, but to the patients and to their families.
That is excellent. Teaching the patients sounds like it's a pretty important thing to do. They can help be an advocate for their care.
Absolutely.
All right, well, anything else you can add about infection prevention here at Gateway, keeping patients safe from the harmful bacteria and those viruses?
Just make sure that you wash your hands, and if you stop at Gateway, if you have any questions regarding infection prevention, just stop by and see me.
Thanks, Sandra.